Not every high blood pressure is treated the same way, and doctor often recommend different drugs for different patients depending on the condition of that patient. So if you or someone around you has high blood pressure, this is something I need you to pay attention to. So when high blood pressure becomes very high, that begins to affect your vital organs, organs like your heart, like your brain, like your kidney, like your liver, it becomes what we call hypertensive emergency. In hypertensive emergency, the blood pressure is about 180, 120, and it's already affecting your organs. Organs like your kidney, your heart, your brain, your eyes, and you can see things like stroke. You can see things like sudden kidney failure, heart failure, or even vision problem. At this stage, doctors often avoid regular oral medication because it can be what unpredictable and act very slow. Instead, doctors often prefer IV medication, which are the what intravenous medication, because they act faster and help doctor control the blood pressure more carefully. Some of these IV medications are lebetalol, nicardipine, and sodium nitroprusside. However, when there's high blood pressure but there's no evidence of organ damage to your vital organs like your kidney, your heart, your brain, doctor often call this hypertensive urgency. And they use oral medications like nifedipine and captopril to treat this high blood pressure for it to go downward gradually. This is because the patient is very stable and the blood pressure does not need to be reduced immediately with IV medication when it comes to what hypertensive urgency. Now let's make this simple. Remember when I say hypertensive emergency is when there's evidence to what organ damages. Why hypertensive urgency? When there's no what evidence to any what organ damages. They use IV medication for emergency, while they use what oral medication for what urgency. One of the things doctor often consider is that blood pressure should not be lowered too quickly because sudden drop in blood pressure can reduce the blood supply to important organs like your brain and your heart. So if someone has extremely high blood pressure with symptoms like chest pain, blood vision, confusion, severe headache, or even what vision problem, that person needs emergency medical attention and should not be treated at home. High blood pressure may seem very silent, but in emergency situation, the right treatment at the right time can prevent serious complication to save what life. So till next time, follow odinakasumary for simple educative health education.